Let's start by reviewing 2025 star rating highlights. I'm going to break down my review into two different areas. We'll start with the cut points and then we'll move up a level to plan performance. Let's jump in. Okay, so the graph that you're looking at here is the year over year cut points trends. Between 2024 and 2025, 56% of cut points increased, about 19 stayed the same, and 25% of cut points decreased. This breakdown is roughly the same as last year, with just a few more cut points increasing. So once again, the majority of cut points increased since last year. Just a quick memory refresher. Recall that the Tukey outlier deletion methodology removes extreme outliers from both the top and bottom range of the contract performance uh, for each measure. For most measures, the bulk of outliers occur at the bottom end of the performance range. So when those outliers are removed, cut points move up. 2 and 3-star cut points see the most shift upward, but 4 and 5-star cut points can be affected as well. The removal of outliers also results in a compressed performance range. In other words, the distance between the lowest and the highest performance isn't as big as it used to be. So the distance between one cut point and the next becomes smaller. We definitely felt the impact of Tukey in 2025 cut points. Many cut points increased significantly year over year. So if you were feeling like you were caught off guard by the cut point increases, you're not alone. Both small and large, new and old plans felt these shockwaves. As this chart shows, there were many measures where nearly all of the cut point thresholds hit the maximum increase allowed by the 5% guardrails. We haven't seen a year with this much movement before at almost every star level. So let's take a look at a few specific examples. Medication reconciliation post-discharge cut points increased by 19 points overall. This is an established measure, so guardrails do apply, and each cut point can't move by more than 5 points. The 3, 4, and 5-star cut points all hit that guardrail. In general, CAPS measures were more or less stable. However, getting appointments and care quickly measure went up substantially. Recall that the CAPS measures aren't held to those 5% guardrails. Those apply only to non-CAPS measures. Every cut point threshold increased by 6 points for a total net increase of 24 points. To be honest, this one surprised me. In my lived experience, I'm still having a hard time getting timely doctor's appointments, and specialists take even longer. I'm surprised the plans were able to make so much progress on this measure and increase the cut points this much. New measures are not limited by guardrails either, as they only apply after the first 3 years. Controlling blood pressure saw a net increase of 26 points. Now that the measure is more established, we should see those cut points stabilize somewhat, but they're still likely to increase like other established measures. Fun fact for you, all 4 of these cut points are higher than they were when they were set in 2019. That was the last year that this measure was part of the star ratings program before it was removed to the display page for a revamp. At that time, a 2-star was 51 and a 5-star is 82. So we're already higher than the highest it was set previously. Let's quickly touch on national averages next. Higher star rates don't always correlate with higher star ratings. For example, the national average rate for breast cancer screening went from 70% in 2023 to 73% in 2025. But the national average rating for breast cancer screening dropped from 3.7 to 3.4 during the same time period. Your takeaway here is that cut points are getting harder, and plans should not expect to achieve the same ratings simply by maintaining their performance. They must continue to focus on improvement. Over the last decade, the national average rate has increased for roughly 90% of measures in the star ratings program. So let's recap the 2025 star ratings results. Cut points are trending higher due to outlier deletions, distribution compression, and the return to pre-COVID performance. Maintaining performance is not enough to maintain star ratings. Plans should be using predicted cut points when setting targets for proactive measurement. Now that we've covered cut points, let's switch gears and talk about plan performance. How did the plans fare at the contract level in 2025? This chart shows the percentage of plans at each star rating level. The number of 5-star plans continues to shrink, while the number of 3 and 3.5-star plans continues to increase. There were just 7 5-star plans in 2025 compared to 31 in 2024. This reinforces CMS's messaging that higher star ratings should be reserved for truly outstanding performance. A 5-star rating is not something that most contracts should plan to achieve. This next graph looks at the change in contract rating star years, the contract star ratings between 2024 and 2025. Looking at the plans that had measure rates in both star ratings, there were nearly equal amounts of contracts with increases and decreases. 40% of the market maintained the same rating as last year, and another 50% either lost or gained half a star. Outliers made up the remaining 10%, either gaining or losing at least 1 star. There were 2 plans that gained 1.5 stars since last year. So kudos to these plans for their achievement. It's truly remarkable. Healthcare Services Corporation jumped from 2.5 to 5 stars, and the Alignment Health Plan jumped from 3 to 4.5 stars. So congratulations to them. I also want to take a moment to highlight the accomplishments of our Cotiviti customers as well. Once again, Cotiviti customers outpaced the rest of the industry. 47% of contracts submitted with Cotiviti scored 4 stars or higher, compared to just 36% of contracts that use alternate quality solutions. 57% of all 5-star contracts work with Cotiviti for quality and stars. Only 1% of plans submitting for MA star ratings without Cotiviti received a 5-star rating. So congratulations to our Cotiviti customers for a very successful year. This next slide compares the number of contracts at each star rating level compared to the enrollment at each star rating level. The bars represent the number of plans at each level, while the line represents the total enrollment at that same star rating level. As you can see, the bulk of members are enrolled in plans with higher star ratings. This is proof that the star ratings truly do matter to consumers. The Star Ratings program continues to provide customers with meaningful guidance for selecting a Medicare plan. Customers consistently pick plans with higher star ratings. Another fun fact for you, in 2024, 72% of members were enrolled in a plan at 4 stars or above. In 2025, that number has dropped to 61%. That's a huge decrease in just 1 year of 11%. So, how did the star ratings results shake out in quality bonus payments? After increasing by more than 400% between 2015 and 2023, quality bonus payments will decline by 8% or $1 billion to $11.8 billion this year. The 2 biggest MA insurers in the country, United Healthcare and Humana, will receive half of the total bonus payments in 2024. That's $3.4 billion to United Health and $2.5 billion for Humana. My takeaway for this slide is that plans should expect QBPs to be harder and harder to achieve and to plan for that. We've really reached the peak and now we're on the downward slide. Medicare Advantage has to continue to cut costs to remain solvent. They need to continue to find creative ways to reduce costs, and I expect that one of the biggest ways they'll accomplish this is by continuing to reduce quality bonus payments. So one example of this would be the Health Equity Index. While it is meant to increase health equity, it is also expected to result in a 10-year savings of $5.13 billion. So I definitely expect Medicare Advantage to come up with creative ways to continue to decrease costs. All right, let me summarize my key takeaways on plan performance. Both large and small MA payers are struggling. All plans are dealing with the same headwinds: rising healthcare utilization, decreasing reimbursement rates, increasing medical loss ratios, and intensifying competition. Everyone is feeling the squeeze right now, and these trends are expected to continue for the next several years. More so than ever before, it's important for plans to focus on the strategies that will help them succeed and differentiate themselves from the rest of the market. I also want to mention a few lawsuits that are currently in progress over the 2025 ratings. For United Health Group, one phone call made the difference between a 4-star and a 5-star for the call center measure. Just this morning, I read that Centene filed a similar suit this week, stating they missed a 5-star rating due to a similar mishandled call. The takeaway for all plans based on these lawsuits is that every phone call counts, every gap closure, every member interaction, they all count. And plans truly need to strive for excellence in all areas in order to achieve 5 stars. The other lawsuit out there is Humana. Humana believes that their contract would have received higher star ratings had the cut points been correctly calculated. However, Humana says CMS would not allow them to validate or challenge the calculations because the agency denied the company access to the data needed to do so. It also states that CMS calculated 2-star rating measures incorrectly. So for this lawsuit, my takeaway for all plans is make sure you're reviewing all of the star rating calculations during the plan previews if you're not already. Mistakes happen and you don't want to miss out on higher star ratings due to a calculation error. If this lawsuit results in a recalculation of cut points, it could trigger recalculations of star ratings similar to what occurred in 2024. A lot remains to be seen on the direction of this lawsuit, though, as it was just filed earlier this month. Okay, we've completed our review of the 2025 star rating highlights, including cut points and plan performance. Now let's quickly review the upcoming changes to the star ratings program. This graph shows how the star ratings pie has continued to change over the last several years, with some categories increasing and others decreasing. In measurement year 2025, which is colored blue in the graph, 49 measures will make up the star ratings pie with a total weight of 85. Together, the clinical HEDIS and pharmacy measures make up 36% of that pie. The CAHPS and HOS measures total 14 measures for 31% of the pie. So there's much more balance between the clinical and non-clinical measures than what we've seen in the past. Those two 5x weighted improvement measures contribute 12% towards the overall total. Recall that this year, member experience measures, mostly CAHPS, dropped from a 4x to a 2x. This increased the relative weight of all of the other measures and categories towards the overall star ratings pie. So for example, the relative weight of the HEDIS category increased from 17 to 25%. 3 new measures will be added in 2025. Care for Older Adults Functional Status Assessment, which was previously part of the star ratings program, returns at a 1x. Concurrent use of opioids and benzodiazepines is also added to the pharmacy category, as well as polypharmacy, use of anticholinergic medications in older adults. I said it right. So those two new pharmacy measures will be included in 2025. For new measures, take a look at the display measure data that's available. Compare your plan's performance against the rest of the industry and see how you stack up. That way you can take a proactive approach to these measures in 2025 rather than being reactive when official star ratings are published for these measures. Some plans might be feeling good about where they're performing, while others may need to be strategizing. There'll be some measurement retirements as well. MTM program completion rate for CMR moved to the display page for measurement year 2025 and 2026. CMS indicated that a retooled version will return to star ratings in MY27 as a new measure. Additionally, we'll see the 3 med adherence measures retired because they'll be replaced by the risk adjusted medication adherence measures the following year. These measures will follow the same numerator and denominator methodology, but now the population will be risk adjusted for sociodemographic status. These will be introduced as a 1x weight their first year back in the program, to be followed by an increase to 3x weight the following year. 2 previously retired health outcome survey HOS measures, which are improving or maintaining physical health and improving or maintaining mental health. They will also be returning. They'll be brought back with a weight of 1x, followed by an increase to 3x the following year. And last but not least, let's not forget about the Health Equity Index. HEI replaces the reward factor in MY25. Both rewards added up to 0.4 stars towards the overall contract rating. Whereas the reward factor rewarded high and stable performance, HEI rewards high performance in populations with social risk factors. So plans are eligible for this reward based on the proportion of its membership with social risk factors and how well those members with social risk factors are performing. That health equity index was put into place to combat a concerning trend for D-SNP members. Recent years have seen a decline in quality outcomes and HEDIS scores. As this graph shows, plans with higher percentages of D-SNP members, which are all the way to the right, have lower HEDIS scores and sharper declines year over year. CMS wants to encourage plans to reduce these disparities in care, so they created the Health Equity Index to reward plans for high performance in those populations specifically. Tracking and focusing on these members has not been a focus for some plans in the past, so programs will need to be put in place to better support these populations. So to summarize the upcoming policy changes, there are lots of upcoming measure changes, several retired, several new. If it seems like a lot to keep up with, it is. The star ratings program is evolving faster than ever before. CMS is really keeping plans on their toes, and I don't expect the changes to slow down anytime soon. With those risk-adjusted med adherence measures and the health equity index, CMS is really trying to reduce those disparities in care that were brought to light during COVID. Plans need to keep up with these changes by monitoring the advance notice and the final rate announcements and proactively prepare their organizations for the changes ahead. This is not the time to be reactive. So, based on the 2025 outcomes and the upcoming program changes lying ahead, I'd like to share with you our recommendations for strategies for improvement. I can categorize my strategies into 3 areas of focus: tracking to a plan, improving and innovating, and maximizing your ROI. So let's start with focus on tracking to a plan. Define the goal for your plan and make smart goals to get there. For example, do you want to be the top rated plan in your market, a 4-star plan? Do you want to be exceptional with customer service or something else? Once that goal is defined, it's important to gain alignment from your executives and stakeholders. Then, when it's time to make hard decisions or request budget for initiatives, everyone's on the same page and you have the needed justification to support your requests. Next, track to predicted cut points. We saw how much those cut points are increasing. So if you're still tracking to CMS cut points, you could fall well short of your star rating goals. And identify the best math path to achieve your goals. Prioritize your measures based on their ability to achieve the next star rating or maybe achieve significant improvement. Every measure should have a clear goal to work towards. My next strategy is to focus on improvement and innovation. Year over year increases in the 2 5x weighted improvement measures is tough. Do you know the rates that are needed to hit, uh, that your plan has to hit to trigger significant improvement for each of these measures? It's pretty hard to calculate, and a lot of plans don't know exactly where that trigger point is. So it's a good thing to try and calculate and plan towards. Plans that continue to evolve and innovate are the ones who will consistently rise to the top year over year. Think about the long term investments your plan needs to make today to succeed tomorrow. For example, measures are moving away from hybrid and towards ECDS. Do you have the infrastructure in place to replace your hybrid lift? Getting that robust system in place is a multi year project requiring large investments. Another example, several new measures will be added in the next few years. Are you tracking them? Are you performing well? What improvements do you need to make today to succeed in them once they're part of the star ratings program? Another example, time sensitive measures like TRC and PCR require quick action. Is your plan able to share near real time data with providers so that these gaps can be closed within the time constraints? And one final example, scoring well on the Health Equity Index likely requires wraparound services to support vulnerable members, such as tailored care management programs, partnership with community groups, religious institutions, housing organizations, nutrition assistance programs, transportation support, mobile health services. All of those programs and partnerships take time to develop. So it's really important to get your strategy in place as soon as possible. These are the types of investments that require planning, coordination, and money. So if you haven't already, the time to start planting those seeds for tomorrow's fruits is now. My final strategy is to focus on maximizing your ROI. Find ways to work smarter, not harder. We all have limited time and resources, and many plans are tightening their belts. I have a few suggestions on how to achieve this. First, focus on whole member care. When you share your member gap list with your providers, it can be so easy just to send them one list for breast cancer screening, another list for colorectal cancer screenings, because that's the way the data is structured. Instead of working on individual measures, help providers see the whole picture of a member by providing them with all of the members' gaps together. This can reduce provider abrasion by pulling together data from multiple reports into one place, and it can also reduce member abrasion by making the most of their visits. Next, focus on member interventions on the members that are most likely to engage. If you don't have the time or resources to reach out to everyone, then focus on the members that will benefit the most from that nudge to take action. Find synergies in the that allow you to kill multiple birds with one stone. For example, if you need to work on the improvement measures, then work on improving performance in the same members that are in the health equity index measure, right? If you focus on your population with social risk factors, you not only improve your health equity index score, you can also improve your improvement measure score. Or you might consider attacking all of your medication adherence measures together. Make sure that folks are on 90-day refills, that they have mail order prescriptions, all of the things that will make it easier for them to get their medications and stay on them. Or you may even want to group all of your diabetes measures together and attack them as a whole. Together, they make up a 9x weight. So it's a great way to attack a big piece of the pie together by focusing on diabetes and all of the measures that surround them together. So ultimately, plans with stronger ratings can reinvest their higher CMS rebates into additional plan benefits, which is a self reinforcing cycle. By tracking to a plan, focusing on improvement and innovation, and maximizing your ROI, your plan can set itself up for continued success in the years to come. So with that, I'm going to turn it back over to Cassie to wrap us up.
Thank you so much, Marge. That was excellent information. The recording of today's session with Marge's review of the 2025 Medicare Advantage and Part D star ratings, the analysis of upcoming measure and policy updates, and her recommended strategies for improvement will be emailed to you and posted on cotivity.com within the week. We'll also be publishing a detailed review on the Cotivity blog. And as I mentioned at the start, this webinar was part of a year-long series titled Quality Decoded, featuring Marge and other experts from Cotivity's Quality and Stars team. If you haven't already, you can watch the recordings of any of these webinars, or you may have missed some of them, or you just are looking for a refresher. You can scan the QR code on your screen and click into the box for the webinar you'd like to access on demand. Stay tuned since we'll be continuing this series in 2025 and we'll be releasing our schedule and registration for those webinars soon.